Good morning, everyone. I'm really honored to be here today to train you about drug and substance abuse. My name is Masia Winja Lolo, CHW, Community Health Worker at Soweto Unit in Soweto Sub-County Hospital. And I'm privileged today to take you through this training. And before I start, I would like you to introduce yourself so that we know each other better. Through this session, at least we'll be familiar with each other. So we'll start at that end. You introduce yourself and the unit that you come from.
Good morning, everyone. My name is Lisa. I'm from Ilana unit.
Thank you, Lisa. Thank you, Lisa. You're welcome.
Hi. My name is Yanta. I'm from the unit of Malaysia.
Thank you so much. Thank you for representing Malaysia.
Hi.
Hi.
Good day, everyone. My name is Nicholas Leonard from Patanisho.
Thank you so much for representing Patanisho units.
Hi, everyone. My name is Dama from Bahati unit.
Thank you also for representing Bahati unit. So I'm sure that we are familiar with each other now. We'll interact well, and I know by the end of this session we'll learn something and we'll be able to spread awareness about drug and substance abuse. So before I start this session, I'm just going to issue out the learning materials so that you write down the important notes that you think are essential. Thank you. You're all okay? I can start the session?
Yeah.
So the objective of this session today is, after conducting a community health assessment in Soweto Community Health Unit, I discovered that many youths were indulging themselves into drugs and substance abuse. So the objective for this session is basically to educate and to spread awareness about the types about the types of substances that are commonly used by these youths. Then the other one is the signs of the signs you can see to distinguish if someone is abusing a certain drug. The other one is the health risks associated with drug abuse. And then the last objective that I have for today is to prevent the preventative strategies that us as the CHVs of different units, because at the end of the day we are one, the Soweto community. So the strategies that we can use to come or to reduce or to take away the drug and substance abuse. So I'm here today to support you through this session, and please, if you have any question, any additional information you want to put across, you are free, because this is an interactive session. So do you know what a drug is? What a drug is? Because I know in each community you are affected with this issue of drug, but through the assessment we saw that Soweto unit was the more affected. So I'm sure as CHB you know what a drug is. Yes?
A drug is a substance that alters the normal function of the body when sleep.
Yeah, okay, yes, that's true. So another definition of drug, you can use her definition and you can also use this definition. So a drug is any substance that can be used to diagnose, treat, prevent, or relieve any symptoms of or medical condition. So when we come to drugs, we find that many youths in Soweto, they used to abuse this drug. So the definition of this drug abuse, now we come now to that, the definition of drug abuse. What is drug abuse? Anyone? Yes.
Right. It's like using the drug in a harmful way. that you are not supposed to use it.
Yeah, correct. So, in other words, drug abuse refers to the harmful or excessive use of these drugs. The drug can be legal or illegal. So you find that some youths in Soweto they overuse this drug. That's what we call drug abuse. So drug abuse may actually lead to mental health relationship. It may lead to over like it can damage the physical well-being of a person. So, do you know the commonly abused drugs by these youths? Can you name for me the commonly abused drugs?
First example,
Alcohol, correct? Alcohol is actually the major one that is abused by youths of Soweto unit. Another one, any
the
bang, exactly. Mhm. Another drug that you've seen is being misused in your units.
Heroin.
Exactly, heroin. So through the assessment at Soweto, the community health need assessment that we did there, we found out that there were 5, imagine 5 commonly abused drugs there, so you can see how intense the situation was there, right? So the first one is alcohol, like you shared with me. That was the one with the highest percentage. Actually, it was 70%. So you find that 70% of those youths, they were using alcohol. Then we had marijuana, or you can call it bang. And in the local, during the assessment, the local area, they call it bangi. You know the youth's language? Yeah, and then the other drug that was being misused was mira. I'm sure we know what mira is, yes, and we are familiar with that. And then there is this drug which was in low percentage, the prescription medication. So you find a drug like they misuse painkillers or the sedatives drugs. So painkillers like Panadol, CHVs, things like that. So they misuse them. And then the last one was tobacco, which was also another one with a high percentage of usage on that in Soweto unit. So we'll go straight to the science to show that the science that you can see in a person to determine if they are using a drug. So these are the factors that you can first observe in a person to determine if they are actually abusing a certain drug. So can anyone tell me what you can first look in a person to determine if the person is overdosing a drug?
can you say the way the person is presenting or the
Exactly.
presentation of the person?
Yes.
Like, for example,
The smell, exactly, yeah, because of the negligence that they have. Because when you actually indulge yourself into alcoholism, you find that your mind is not even into hygiene. You just want to focus on alcohol because you're already addicted to it. Next, any other? Yes, it can lead to depression. So those are the key things that you're supposed to look at when you want to determine if an individual is using these drugs. So for me, I have certain points that you can look first to determine if a person is abusing a drug or not. So number 1, change of behavior. So in change of behavior, you can find that this person has a drastic change, like an immediate change. This person used to be kind to people. You see, he used to be respectful. Let's say maybe a youth at home. You find a young man at home. He used to be respectful to the parents. When they send him somewhere, he would go. But now there has been a drastic change in behavior. He has started becoming rude. He doesn't want to listen. You see, so those as a parent, those are the key things that you're supposed to look at. So when you see your child behavior is changing all of a sudden, you have to observe really well. And then the other thing is physical symptoms. So you can check the eyes. So the eyes, they're always like in red in color. When you use alcohol, when you smoke tobacco, you see that your eyes will start turning red. And then there is when your pupil is dilated. So you see, those are the small things you should observe. Also, severe or a fast weight loss. That can actually be an assurance of someone abusing a certain drug. And then another one, another sign that you can use, number 3 is neglecting responsibility. So in neglecting responsibility, you find out that maybe a father, right? A father has been so hardworking, he wakes up early in the morning around 4, he goes to work, and by the time he comes back in the evening, he has brought all the necessities in the house. But all of a sudden, he starts coming home drunk. When you ask for money, for maybe supper or lunch, he beats you up. Yes,